Hey guys, welcome back to my YouTube channel Med Edophilia. In today's class, we'll be looking at ECG. So there's a very little content given in NCRT about ECG, but its clinical correlation is enormous. So here in this video, we'll be just looking at the basic understanding of ECG, and then later you will realize that there's a lot more to this topic when you enter first year MBBS. So this is how a typical ECG looks like. So here you can see waves, P wave, QRX complex, T wave, and you can see segments, that is straight lines, and you can also see intervals, which are nothing but waves plus the segments. So let's start by focusing on the key points of NCRT. So firstly, you need to know the difference between electrocardiogram, electrocardiograph, electrocardiography. So gram means the paper or the report you get. So that is what is ECG. ECG is electrocardiogram and not electrocardiograph. You might think graph means it's like the graph paper. It sounds like the graph paper. So that is the paper. No, that's wrong. So have a clear understanding that ECG is electrocardiogram, which means paper or the report, which is the graphical representation of the electrical activity of the heart during the entire cardiac cycle. Now, the machine that records this electrical activity, which monitors and shows the voltage on the screen, that is nothing but the electrocardiograph. And what is electrocardiography? It is the procedure in which the entire recording is done. It is the procedure, it is the technique, method, or the process. So you understood the difference: electrocardiogram, electrocardiograph, and graphy. So this basic difference should be understood properly. So an ECG has 12 leads, 3 limb leads, 3 augmented leads, and 6 chest leads. So your NCRT says 3 electrical leads, 1 to each wrist and to the left ankle. Alright. So have you heard of this name, Einthoven? Yes. He is the one who got the Nobel Prize for discovering ECG. So he considered the whole body as a triangle with the heart in the center. So he is the one who identified these limb leads, 3 limb leads. So one lead on the right arm, next on the left arm, and the other terminal connected to the left foot. So remember that the right arm is always the negative terminal and the left foot is always the positive terminal. So the first lead, that is the lead 1, is from the right arm to the left arm. So that is lead 1. And the second lead, lead 2, is from right arm to the left foot. And the third lead, that is, we start from the left arm to the left foot. That forms the third lead, lead 3. So I told you, right arm is always the positive terminal, left foot is the negative, is the positive terminal, and the left arm, since right arm is negative, obviously the left arm should be positive to form lead 1. So since the left foot is always positive, the left arm should be negative here to form the lead 3. So basically what is happening here, so the different parts of the human body we consider as different terminals, as positive and negative terminals, and wires are connected from the body to the electrical machine, the electrocardiograph, and through these wires the potential difference of the electrical activity of the heart is recorded and thereby noted on the screen, and then we can measure and record the electrical activity of the heart. So This is what the three limb leads is what is being mainly focused in your NCRT. Apart from these three limb leads, which is also known as the Einthoven leads, there are also three augmented leads. Augmented, the very word augmented means increased. To how many times? Increased by 1.5 times. So what are these augmented leads named as? AVR, AVL, AVF. So AVR is for the right arm, AVL is for the left arm, AVF is for the left foot. So there's one limb left, isn't it? The right foot is being left here. So what is the right foot's activity? It is not connected to any of the terminals, it's not connected to any of the leads. Instead, it is connected to the earth. It is grounded because to prevent electrical shock, it is grounded to neutralize the charges. So that's why we leave one of the limb as a safety factor, as a safety function. Got it? Then we also have 6 chest leads which are named as V1, V2, V3 and so on till V6. So for a detailed evaluation of the heart's function, there are multiple leads attached to the chest region as well. This is known as chest leads. So there are how many leads? There are 12 leads, 3 limb leads, lead 1, 2, 3 and 3 augmented leads, AVR, AVL, AVF, and there are 6 chest leads. Okay, and this is how the triangle, the Einthoven triangle, one to the right arm, that is the right wrist, next to the left arm, left wrist, and then to the left foot, left leg or left ankle. It is connected to the left ankle. And then from there you have wires finally connecting it to the machine, that is the electrocardiograph. So the leads have positive and negative terminal, and the potential, there is a potential flowing across, there is a current across the terminals, and the potential between the positive and negative terminal is what is known as the potential difference. This potential difference leads to deflection, producing waves in the ECG paper. Okay. So what happens when there is no potential difference? Obviously there won't be any current flow. So there is no deflection, there is no waves. So what happens? What do we get on the ECG paper? We get straight lines. These straight lines are known as segments. These are isoelectric points. That is, the potential difference is the same throughout. The potential is same throughout. So as a result, there is no potential difference. So we say it is isoelectric point. Understood? So the straight lines you see on the ECG paper is nothing but your segments. Now first let's talk about the waves. So we have P wave, the QRS complex and the T wave, right? The P wave represents atrial depolarization or contraction, systole of both the atria. P wave is atrial contraction, atrial depolarization. What is depolarization? It is nothing but the electrical excitation of both the atria. Alright. Now QRS complex represents ventricular depolarization, depolarization of the ventricles or the contraction, systole of ventricles. Next, the T wave. This T wave represents repolarization or returning of the ventricles from the excited to the normal state. So depolarization is excitation, repolarization is returning from the excited state to the normal state. So T wave represents ventricular repolarization. End of T wave marks the end of systole. So this is what you need to know about the waves. What does each wave signify, represent? Okay. So you see the prominent QRS waves. These are the biggest, right? So by counting the number of QRS waves in an ECG for a given period of time, say you count for 1 minute, you have to count the number of QRS waves. So the number of QRS waves, you can get the heartbeat rate. how many times the heart beats for 1 minute. So that can be found out. So tell me, what is the normal heartbeat rate of an individual of a healthy human? It's about it. The range is 60 to 100. Any value between 60 to 100 is normal. Most accepted, or the average value, as an average value you can say it is 72 beats per minute. So an ECG obtained from different individuals have roughly the same shape for a given lead configuration. So what does this tell you? By comparing the ECGs, if there is any deformity, any difference in shape, you can always tell that there is some problem in your heart. There is some deformity or some defect. So this ECG can be used to assess your heart function, whether your heart is healthy or not, whether your heart is performing the normal functions properly or not. Hence, an ECG is also known as a poor man's echocardiogram. Echo, okay? An ECG is also known as a poor man's echo. So here you see, this is the normal ECG paper. You can see there is a P wave, QRS complex followed by a T wave, and then again there is a P wave, QRS complex and a T wave. So this is normal and there is proper rhythm and all of that. Now the next two graphs you can see there are abnormal shapes and the rhythm isn't proper. Can you see there is a difference? So by noting the difference, you can easily say that there is some abnormality of the functioning of the heart. So we spoke about waves. Now let's look at segments. So this is a typical ECG, P, Q, R, S and T, and here you can see two straight lines, right, between the P wave and the QRS complex, and the second one is between the QRS complex and the T wave. The first segment is the PR segment and the second segment is the ST segment. So PR segment. So as you can see, PR segment starts from the end of P wave before the onset of QRS complex. So as I told you, segments are nothing but straight lines where there is no current flow and they represent isoelectric points. So why do you think there should be a PR segment? Technically it should be called PQ segment, but it's commonly known as the PR segment by the clinicians. Okay. So tell me, what is the significance of this PR segment? Why doesn't the QRS complex start right after the P wave? Why doesn't it start immediately after the P wave, and why is there a straight line? Does it mean the heart has stopped? Does it mean there's a pathological condition? No. This is functionally very, very important. This represents the AV nodal delay. The AV nodal delay is approximately 0.1 second. Okay, and this is extremely important for providing adequate time for ventricular filling or relaxation. So what is the reason for AV nodal delay or the PR segment in the ECG paper? It is because when the atria contracts, there should be adequate time. The adequate time is required for ventricles to relax and ventricles to get filled. And only if ventricles are filled, ventricles can pump its blood into the aorta, and then the blood can go on for systemic circulation and then reach all parts of the body. So this is extremely important. There is a functional significance of this AV nodal delay or the PR segment. The second segment is the ST segment, also known as the J point. So ST segment is nothing but it is from the end of QRS complex before the onset of T wave. Can you see from the ECG paper? It is end of QRS complex. It starts from the end of QRS complex till the till just before the onset of T wave. So what is the end of QRS complex represent? QRS complex represents ventricular depolarization, isn't it? And the T wave represents ventricular repolarization. So it is a joining point between ventricular depolarization and ventricular repolarization. Hence, it's also known as the J point. So, what is the ST segment signify? In normal individual, it is a segment, that is, it is a straight line. There is no current flow. But in pathological condition, when there is a problem in your heart, there is current flow noted during the ST segment. This current is known as the injury current produced by the injured tissue due to myocardial infarction. So, this produces an elevated ST or a depressed ST. So it is no more an ST segment, it is no more a straight line. There is pathology, there is myocardial infarction, there is a current known as the injury current produced by the injured tissue producing an elevated ST, and either an elevated ST or a depressed ST. If the ST segment is elevated, that condition is known as infarction. If it is depressed, it is known as ischemia. So for this, I want to talk about the different abnormalities, the pathologies associated with heart. So we have coronary artery disease, angina, and the heart failure, and finally the cardiac arrest. Alright, so what is coronary artery disease? Coronary artery disease is also known as atherosclerosis. Coronary artery is the main artery of your heart which supplies blood to the heart, isn't it? So these vessels, the coronary artery, gets deposited with calcium, fat, cholesterol, and a lot of fibrous tissue. So the lumen becomes narrower and the wall becomes thick because of the deposition of these materials. So there is restricted flow of blood. So this narrowing of the artery is known as coronary artery disease or atherosclerosis. Next we have angina or the angina pectoris. Pectoris is nothing but the chest. Okay. So what happens in angina is that it is characterized by a typical chest pain. So this occurs because there is no enough oxygen reaching the heart muscle. Why? Because the vessels are narrowed and there is no blood flow, and eventually there is no oxygen also reaching the heart tissue. So this is more common in middle-aged and elderly people, and it can occur equally in men and women, but it is more common in the middle-aged and elderly people. Next we have a condition called heart failure. As the name suggests, heart fails to pump blood effectively to meet the demands of the body. So there is a failure of the heart to pump blood, that is, there is ineffective pumping of blood to the body. So what is the characteristic feature? There is congestion of the lungs. So it is also known as congestive heart failure. So what was the characteristic feature of angina pectoris? It was acute chest pain. But here in heart failure, there is congestion of lungs. So this is also known as congestive heart failure. This heart failure can eventually lead to cardiac arrest. What is cardiac arrest? Arrest means complete stoppage. The heart stops beating. Okay. This is the loss of, there is complete stoppage, so the electrical activity of heart is also completely lost. There is one more term related to the heart, which is the heart attack. This is not also angina. Okay, they are more or less the same. Heart attack is nothing but when the heart is the muscle of the heart, that is the cardiac tissue, the myocardium, is damaged by inadequate blood supply. So heart attack and angina are more or less one and the same, but they are not same as heart failure, please remember. So just a small summary of various disorders related to the heart. It is coronary artery disease or CAD or atherosclerosis, which is nothing but narrowing of artery, mainly the coronary artery which supplies blood to the heart. Second one, it leads to ischemia. What is ischemia? I told you ischemia is characterized by flat ST in the ECG. Ischemia mainly means lack of oxygen because of the narrowed blood vessels reaching the heart muscle. Next is this ischemia can lead to heart attack or angina. That is when there's absolutely very less oxygen reaching your heart tissue, and there's also inadequate blood supply leading to an acute chest pain. Next is this leads to infarction. Infarction means death of the heart tissue, the cardiac tissue, and this infarction can finally lead to heart failure, which is nothing but the inadequate pumping of heart to meet the demands of the body. Heart failure ultimately leads to a condition known as cardiac arrest, where there is complete total stoppage of their heart and its functioning and the cardiac activity. So what did we see in today's video? We talked about ECG, the basic structure of ECG. We first went on by understanding the main difference between electrocardiogram, electrocardiograph, and electrocardiography. Then we saw about the structure of ECG. We saw about the waves, the various waves. We saw about segments, and we also saw that there are certain intervals, namely the PR interval, RR interval, and the QT interval. You don't have to go much in detail about this because at this level this much is sufficient, and not much is given in your NCERT as well. So you can this information is more than sufficient, but just know that intervals of ECG are a combination of waves and segments. And then we went on to talk about the applications of ECG, where there is a dip or a depression in your ST and there is an elevation of an ST leading to various diseases or disorders of your heart. And finally we went on to saw about different heart diseases like the coronary artery disease, angina, heart failure, heart attack, and cardiac arrest. ECG, remember, it can also be used to assess the rhythm of the heart. We know that cardiac tissue does not get fatigued. It beats rhythmically and it is non-stop. Okay. The interval, the RR interval which I told you, is from one R to another, that is from one QRS. So in the QRS, you can see a peak that represents the R point, right? So the R point of one QRS complex to another QRS complex, you can see that has to be equal for an equal rhythm, for a normal rhythm of the heart, and the P wave should occur between every QRS complex. That is the main characteristic of a normal rhythm or a sinus rhythm, we say. And we also saw that counting the number of QRS complex will give us the idea about the heartbeat rate. So by knowing to read the ECG properly, you can come to a conclusion about whether the cardiac tissue, the muscle, is functioning properly or not. So this is the end of this video, and this is everything that you need to know about ECG at this level for your NEET preparation. Thank you so much. Happy learning.